Hello, this is Ahmed Nsaif, medical instrumentation engineer, credit to Nahrain Najim. Today we're gonna go talk about the electrosurgical unit or diathermy unit. So how are we gonna go? Let's start. So the principle of the diathermy or electrical surgical unit is popular. So when an active current passes through the active electrode, active cable through the patient on the patient plate and depressive cable, which is cut the electrical AC. Let's go with the intensity and the waveform of the electrode and electrical property of the tissue. Hence, we're gonna study the size of the electrode. So, the RF or diathermy has two types: monobipolar and bipolar. So, let's talk about the monobipolar. The monobipolar electrosurgical unit is commonly used and it has AC current electrical. However, also there is a generator which is conducted the electrical passive through the active electrode through the patient and on the plate. The plate is cutting the electrical passive through the tissues to achieve or obligation. The surface plate or passive electrode passes through the electrical device. So, and it has the pad which is connected to the body for the low heat and low concentration of the density. So the high heat is connected to reach the body tissue that wanted to be adducted or obligation, as we can see on this video. Also, the return electrode pad, it's connected to the patient body to protect him at the same time, which is very important. The bipolar diathermy, we must mention this. It has two active electrodes. One active electrode passed through the diathermy forceps, passed through it the AC current, and the other one is backed through the device, which is this mechanism to protect the body patient. So this was the fast illustration and detailed to the diathermy device. So the other video, we're gonna go through it for this video as we can mention it. So the diathermy is important. Why is it's so important? So let's go. So first is the electrically the diathermy induced heat is used to cut or obligation or colgate the tissue during the surgery, or sometimes allows the percepts incisions to made up with the limited blood loss and is now nearly to all surgical procedures. So it's also commonly used in surgical procedures, as we know. They see the difference between the monobipolar diathermy and another one is bipolar diathermy. However, the monobipolar diathermy is looking like, whereas the bipolar diathermy looks like a bargains together, and monobipolar earth plate is used to receive the current. For bipolar, no need to use the earth plate because it has a receiver. And at the same time as monobipolar and diathermy performs both cut or coagulation, but bipolar performs only coagulation at the same time. So in monobipolar, the current comes from the tip on end of the earth plate. In bipolar, current comes from the one paddle and goes by another paddle. As we mentioned, the electrode current separate discipline is not used near to the organs. Current separates locally, and are some difference between monobipolar and bipolar diathermy, which is important for both of them. Important points for regarding for the monobipolar diathermy is like the color between them. So let's go for the color between them. So the yellow is used to cut and the blue is used for coagulation or obligation. However, so the continuous current looks like used for coagulation. For the blue, it has a high voltage alternative current. Hence, for the patient is monobipolar diathermy doesn't work without connecting an earth plate, and earth plate is also wide for the skin tissues or reduced hair on it, and it flow through the current. So we don't use the pad again and again because it has used for one time only, because sometimes it goes burns and attached with the body tissues. So we should be mentioned as a medical engineer that some patient who has a pacemaker, we should not use the electrosurgical unit with them, and we will be cautioned when we use the electrosurgical unit because we have two active electrodes, and it's important regarding to the monobipolar diathermy as a patient with what a pacemakers. Lastly, we don't use the place of vital nervous, active nervous in the body.